Right, so this patient was referred to me for the extraction of his upper right first molar tooth. The referring dentist had extirpated the tooth and found a mesial to distal fracture along the base of the pulp chamber, which deemed the tooth to be unrestorable. Having had a conversation with the patient, he wanted to have an implant in the future. So the plan was to remove the tooth as atraumatically as possible to preserve the bone, preserve the soft tissues, and plan for an implant once he was ready. So if you have a look at the radiograph, there's a little bit of horizontal bone loss around the tooth. There's 3 roots which are relatively long, and the bone density appears to be fairly soft. It doesn't look as though there's any involvement with the sinus because the sinus floor isn't visible on the radiograph. So in terms of planning to remove this tooth, the best way to do it would be to section the crown, to remove the crown, and to separate the roots. And by taking one root out at a time, we can reduce the pressure on the bone and reduce the chance of there being any fracture of the bone, and to preserve the bone around the tooth for a future implant. So let's see how we got on. What we're looking to do is to section the crown at the level of the CEJ horizontally. So I introduce my Fisher burr laterally into the tooth. I'm punching into the coronal pulp. And once I've dropped into the coronal pulp, I'll use that as a depth gauge for me to then section easily and distally around the crown of the tooth in order to remove it. I'm looking to go about halfway across the crown with my Fisher burr to create a point of weakness, and then I can pop the crown off. By supporting the crown with my finger and introducing the luxator into the space I've created, I can then separate the crown and remove it cleanly. I can then refer back to my radiograph to then decide on how best to section the roots of the teeth. My preferred approach is to go straight through the coronal pulp and lidocation down the long axis of the tooth, and then section buccally between the 2 buccal roots. The 2 buccal roots and 1 palatal root. I'll then go back to the middle, where I've started my section, and I'll then section distally and mesially, being mindful not to touch the bone of the adjacent teeth, or to go further and touch the roots of the adjacent teeth. You have to be very careful when doing this. Crucially, by remaining as upright as possible and by sectioning down the long axis of the tooth down to the depth of where the application is going to be, it will give you a good point of application to separate the roots and prevent the roots from fracturing when removing them. You now see in the mirror that the roots have been separated. The 2 buccal roots are separated from each other, and the palatal root is separated from the buccal roots. We can then introduce a luxator or a couplens and separate the roots from each other by introducing them down the long axis. When removing the roots of the first molar tooth, you can gently work your way around the distal aspect, the buccal aspect of where the roots are. You can go between the roots and elevate with couplens, or go laterally and try and elevate with or luxate with a sharp luxator. I've gone down the long axis of the tooth here with the luxator. The roots are now separated, and I'm just trying to tease that root into the space created, both distally and mesially. And because it's a fairly straight root, it will lift out with an instrument, and in this case, it's lifted out with a luxator quite cleanly. I'll then introduce my luxator between the palatal and the mesiobuccal root and twist again, just to ensure that the 2 roots are separated from each other. Once I can see movement, like you can see in the mirror, I'm happy then to luxate. So now I'm going to luxate mesial to that mesiobuccal root, and the aim of that's going to be to push it down the long axis and to work that root into the dead space I've created distally. And it should be fairly predictable once you've got a good split. For the palatal root, my method of choice is generally to pick up some root forceps and work down the long axis of the tooth and to rotate. The reason I use root forceps is to reduce the chance of me pushing on the root and displacing it into the antrum or slipping at the back of the mouth. And putting root forceps on and rotating, you can quite predictably remove the root of that tooth. So at this point I can see the bone has been preserved and the patient will return in 3 months for a future implant.